We'll return to one of our big themes on the program today, and that's World Mental Health Day, which is a day used for global mental health education, awareness and advocacy against the social stigma. Now, each year, the South African Federation for Mental Health supports the theme chosen by the World Federation for Mental Health. And this year, the theme is Young People and Mental Health in a Changing World. Well, to talk us through this day and the theme, I'm now joined by the SAFMH's Project Lead Information and Awareness, Nicole Breen. Nicole, thanks very much for joining us. Welcome to the program.
My pleasure.
All right, so let's start with sort of some definitions, because mental illness comes the whole spectrum, and some of it leads into disability. Take us through, just so that we can get an understanding of where mental illness fits on the spectrum.
Well, the South African Federation for Mental Health focuses on mental illness, psychosocial disabilities and intellectual disabilities. Mental illnesses involve feelings, emotions or experiences that are beyond the normal range. When these become pervasive, these become known as psychosocial disabilities, as in they're actually disabling. An intellectual disability refers to instances where a person's intelligent quotient is below a certain amount.
All right, so what are you trying to do during the course of this month, and then in particular this day? We'll discuss the theme itself just now, but for mental illness awareness generally.
Well, our theme is multi-pronged. Today we have for World Mental Health Day, we had a policy dialogue on the aforesaid theme, and we launched a study on it as well entitled Young People and Mental Health in a Changing World, Snapshots and Solutions. We're also having a social media campaign releasing a series of press releases and opinion pieces.
All right, well, talk to us a little bit about some of the things that have come through this study.
Okay, well, like I said, what we aim to do is provide snapshots of various mental health issues affecting young people. So these were very broad-ranging. You know, they included everything from stigma, self-harm, suicide, social media, gaming, traditional medicine versus Western psychiatry, crime. There were 14 themes in all. And what we aimed to do subsequent to that was to provide policy proposals surrounding, what should be done, how to build something around these issues that would protect and uphold the rights of young people.
So what are the big things that young people are facing in this changing world? I know that it's very digital, and social media is now something that's almost standard practice and language. Is that brought with itself a new range of mental illness issues?
Well, if you look at social media, there are certain pressures on social media. You know, there's this perfect life phenomenon where people feel compelled to live up to certain expectations. You know, people post pictures of vacations or successful relationships and so on. And I mean, nobody's life is perfect. Everybody has their sort of trials and tribulations and struggles. And as such, this is all largely quite false, but it can make somebody who's going through a difficult time feel quite bad about themselves. You also have the threat of social media addiction, with some teens spending up to 9 hours a day on social media, 60% of the time being on their cell phone. You also have what has been termed by the World Health Organization as gaming addiction, where a person's computer game habits, be it on a mobile device or on a PC or laptop, actually begin to pervade into their life, causing them to neglect things like family, friends, stop eating and sleeping normally, etc. So it's generally brought with it its share of challenges. There are positive aspects to it as well. You know, for example, gaming teaches you problem-solving skills, and social media provides peer-to-peer support. However, like I said, there are lots of challenges. A further challenge that I didn't mention is the threat of cyberbullying, which is a very serious concern.
So what can parents who perhaps watching this and they've got young people in their care, what sort of things typically should they look out for that might be signals that, maybe something is wrong, maybe an intervention is required to help their children?
Well, you'll soon find that young people will start losing interest in activities they previously enjoyed. They'll be distracted, they'll seem depressed and unhappy, they'll seem obsessive, and it would seem that given that things like social media can have consequences of inducing mental illness, that you would likely find the symptoms of things like depression or anxiety or other mental illnesses.
All right. What's perhaps just in finality, what's the big message you'd like to share with the public today on this important day?
I think very clearly that there is not enough awareness surrounding mental health, and there's still a great deal of stigma surrounding it. I think the message we need to spread is that there needs to be more human rights education, self-education, and thus advocacy and self-advocacy. People need to learn about mental health and, its ramifications, but also the fact that people with mental illnesses can live successful lives with, stable family relationships, and working successfully in jobs and so on. And particularly with regards to young people, there's a tendency to write them off, when young people have a mental illness, thinking they have no future. We would like to articulate that this is not the case.
All right. Well, let's hope that that message gets through loud and clear. And it is Mental Health Awareness Month, so we'll continue to explore this theme a little bit more for the rest of this month. Thanks so much for joining us on the program and sharing your thoughts with us.
My pleasure.
Thank you, Nicole. All right. So you've been